Hi, my name is Race Nelson. I'll be doing the meter dose competency. One of the first things you want to check for are the physician's orders. You want to see the medication that's been prescribed by the physician and the equipment that's been needed. When it comes to the equipment, you want to make sure it's been inspected and cleaned. That's for any type of equipment. You want to make sure it's cleaned, okay? And the equipment I'll be using today, it's the stethoscope, the reservoir, the inhaler of course, pulse ox, and a peak flow meter. Then you want to check the patient's chart to see any trendings that's been about from past RTs. You want to see first name, last name, date of birth, history of other hospitalizations, any childhood allergies, and if you want to do latex allergies as well, just to check. Then you want to check any X-rays that's been ordered, or also any other sputum production that's been collected by other RTs, the viscosity and the color. From there, I'm going to enter the patient's room, and I'm going to go ahead and say hello and do my procedure, okay?
Come in.
Hi, my name is Race. I'm a respiratory therapy student. Can I get your first and last name, please?
Yes, Diana Cedeno,
And date of birth?
9/21/92.
Excellent, thank you. And can I get your wristband, please? Thank you. And your physician ordered a inhaler treatment. Have you used the one before?
Yes.
Okay, good. So the one we're using today is called albuterol. It's just designed. It's a rescue drug. So when you have breathing, you take it. But what it's designed to do is once you inhale the gas, the inhaler, it's supposed to open up your airways and make you able to breathe much better.
Okay.
Okay. And the side effects when you take the albuterol, it's you increase heart rate, and also you might feel a little tremory, like you have coffee. But that's a normal side effect. Most all people do experience. So throughout this, I'm gonna give you some medication today, but I'll be checking your vitals. Okay.
Okay.
Before we start, I'm going to check for lung sounds. Okay.
Okay.
All right. And do you mind if I call you Diana?
Yes, that's fine.
Okay. And do you feel comfortable with checking? Checking on your chest sounds. Or you want me to do the back?
Just the back.
Just the back. Okay.
Yes.
Good. Okay. And you're breathing today. How's that feel today?
A little tight.
A little tight.
Yeah.
Okay, good. That's not good. Okay, we'll see to reverse that tightness.
Okay.
I'm going to check. I'll start with your back.
Okay.
Well, I'll check your neck real quick. Just
Okay.
breathe through your mouth right here. Okay. All right, your back. Do you want to grab onto the ledge so I can just get the neck, please? Thank you so much. Okay. And breathe in. It sounds good. There's some little wheezing, but it's nothing severe, so hopefully after the treatment you'll be able to breathe better.
Okay.
Okay? Alright. I'll go ahead and check your this reads your oxygen that's in your blood, and thank you so much. Alright. Excellent, good pulse. Okay, thank you so much. So it looks pretty, your numbers look pretty good. Okay. So I checked her pulse, and it was I counted her for 15 seconds and times her numbers by 4. She was pretty stable. Her pulse was, so I feel comfortable with counting just 15 seconds. And yeah, I got her vitals. I'll show you the numbers. 72. So it was 18 beats for 15 seconds times 4 equals 72. Then she had 5 breaths per minute, so that's 20. Kind of borderline, but I mean, she seems it might be a normal number for her. But yet, hopefully, it decreases after the onset of the medication, right? Tachycardia, right? Well, not tachycardia, but increased heart rate. Okay, thank you so much. I'm gonna go ahead and use this here. This is a peak flow meter. It just reads how strong your lungs are right now. You know, so what I want you to do, if you could, you breathe through here, and then I'll record the best number you can do. Okay. So just 3 times of these, and if you feel like lightheaded, we could just stop and let you come to breathe better. Go ahead and it's not yours, but okay. Thank you so much. Good. All right. Let's try a little bit better this time. Okay. All right. Yeah. Good job. That's better than the first one. Okay. Let's do it one more time. There we go. Thank you so much. Yeah. All right. Thinking here. I'm thinking now. It was below the predicted number, but still encourage. Yeah. And also, if you feel the patient, the numbers like out of 3 weren't like accurate. Like let's say one was low breath and one was a high one. You gotta make sure you do another. Have them do it again. Because you want accurate numbers, not just what you want accurate numbers. They're full kind of. The trying. You make sure they're trying when they use this device. Okay, thank you so much. Okay, now I'm going to show you. Well, you're familiar with MDI, but still I'll go and show you. Thank you. Refresh your memory. All right. So this is your albuterol. As you know, it's your rescue inhaler. So if you have a asthma attack, you can go ahead and just take this, and I'll open up your airways, okay? Before you use it though, if it's at any time, before you use it, you want to make sure you mix the medication here. And when you do this, it makes the solution in here, the gases in here, kind of more mixed, mixed together, which is what you want. Then from there, you place it in here. So body temperature, when you do this, you want to make sure it's body temperature. You put this little hole here for this. You just slide it in here. And if it's brand new or been sitting out for a while, you want to. That's called priming it. You just clear it out with the in here. Yeah. So it's easy to carry, which is nice. But this is your reservoir. What this is made to do is when you put it in there. When you push this, it captures the gas here, and it waits for you right here until you breathe out. You take a breath in. So it's effective that way. That's pretty cool that they have these. It's kind of annoying to carry this because it's kind of big. It's kind of blocky. But I recommend carrying it with you. But if you don't have it on you, you can still use this. It's better to have some medication than no medication. So I recommend just trying to carry both. But if not, carry this for sure. So that's how you use it. If you breathe in, so once you have the medication in here, you if you breathe in too fast, it makes a whistle sound. So that means you went too fast. So you want to just take a nice, breathe out first and a nice, take a deep breath in. And if you want, you could lift your throat up, and it allows the gas to go, better. It allows it to flow better to your lungs. Okay. But you can do that. So it's 2 puffs. So you take it's 2 puffs, and you wait a minute. So you want to try to explain
Sure.
how it works?
So if it's a new medication, you have to use it for a long time, you just want to
And
warm it up
yes.
and shake it. And then after you do that, you just stick it back in and then do it twice to prime it so it takes out all the debris. And then you just put it into your reservoir, take the puff, exhale first, tilt your head back, inhale, and then hold it. And then you would just exhale, right?
Yeah.
And then I would take 2 puffs whenever needed.
Good job. Good job. So whenever you need this, this is your rescue medication here, okay? So you know what, that was pretty good, thank you. Yeah. And when you do clean it, you want to just use sterile water and just rinse it out. And you want to let it air dry as well, okay? If you try to dry it up in here, it creates a static that kind of attracts the medication on the side, so deposit could build up and block, your flow of medication. So you want to make sure you clean it, weekly. Okay, I'm gonna go ahead and have you take 2 puffs, okay? And make sure you tilt your head and hold for 10 seconds like you said. Good, good. Yeah, I'm gonna pretend a minute passed. So just, good, hold for 10 seconds. Good job. Okay, yeah, that's real good. Okay, so when you're discharged, or when you leave home, I'll be sure to give you one of these. Okay, this one I'll be taking with me, but I'll be sure before you leave, I'll be giving you one of these so you can use it, okay? All right. Yeah, good job. How do you feel now? Do you feel
A little bit better.
a little better?
Yeah.
Good. I'm going to go ahead and check your lungs again, make sure that wheezing went away.
Okay.
Okay? Thank you so much. Okay. Excellent, thank you. Good. Sounds. I went away. Can I check your throat one second, please? And right there, mouth, please. Okay. Yeah, that's good. That's a good medication. It's working very well. I'm glad you're breathing better. Good. All right. Let's see if your heart rate increased. It's normal if it does. Okay. Thank you. Thank you so much. Her heart rate increased a little bit due to the medication. It was 20 beats in 15 seconds, so it's 80 beats per minute. The pulse rate, heart rate, and respiratory rate was It was sorry, it was 5, so it was 20, so still a little high, I guess, but that's okay. She must have felt, well, her heart rate, her breath rate was at 20 when I first did the vital signs, so maybe that was just due to her not able to breathe that well, so she couldn't really, she was breathing more, and now she's breathing, the same rate though, but that could be due to the medication, so, I mean, she seems fine, stable. I think she'll be okay. Alright, so I checked that. Peak fall. Alright. Okay, I'm going to have you do this again last time, okay? Same thing, just breathe in 3 times. I need to try the best one we can get. Okay? Nice. Alright, good job, thank you. Nice. Okay, good. Yeah, it's getting better. Yeah, really good. Let's try to get it stronger this time. Nice. Okay, yeah, good job. Good job. So again, I think I'll give you this as well. No, this is fine. So yeah, so again, I'll be giving you your meteor dose inhaler when when you're discharged from the hospital. Okay, everything looks good. Your reason went away. So do you have any questions? You're good. Okay, thank you. And okay, that's good. And do you have the do you have any do you have the cough or anything like that?
Sure.
Yeah. Okay. That's a good sign. Your airway's opening up, so it's getting rid of that mucus. Nice. Good job. Thank you. Yeah, good. Okay. Okay, that's good. I'm glad you're doing much better. If you have any questions, there's a call button. There's a call button on the side of the bed here, and also put this up here. Also on this side as well. And the remote has one also too, put right here. So if you have any questions, you just push that, and then the nurse can get me. Okay.
Okay.
Okay. Well, I'm glad you're doing much better.
Thank you.
All right. Thank you. Have a good day.
You too.
Before you leave the room, you want to just take your gloves off. Just here, clump it up, and then dispose it at a garbage can. That's kind of far away, but hand sanitize your hands. Okay, so everything looked good. She had a good cough, productive cough. Got some sputum out. It sounded clear after she did cough. She felt like she got everything out. So now I want to just go ahead and hand sanitize my ox before I go to the other patient and clean my stethoscope as well, and document of course the changes, the FIO, the FEV. You want to do the post numbers minus the pre divided by the pre. So you see a change, and you want to see a change by 20% usually, but that's what you want to see. Okay, well, I mean, I'm gonna go ahead. Well, you analyze the sputum. I collected some, so that's what you would do next. So that's all I have for you folks. Thank you so much.